I'd like to welcome Dr. David Borenstein. Welcome, David.
Thank you.
Could you tell us when you first heard about LDN?
Yes, I first heard about LDN approximately 5 years ago, actually from a patient who approached me who wanted low-dose naltrexone to improve his immune system. At that time, I knew very little about it, and I was a little bit skeptical. Anytime something is new, there's always going to be a little bit of resistance and skepticism. So what I did was I researched low-dose naltrexone. I found it to be an amazing discovery, so I prescribed it to the patient.
And what condition was that for?
Well, for this particular patient, the patient wanted it primarily just to improve his immune system. Then I had more and more patients come in for various different ailments. I had patients come in for multiple sclerosis and for irritable bowel and Crohn's disease. So I started getting more and more patients requesting low-dose naltrexone, and I started prescribing it. And the good news is I got amazing feedback and amazing results. And they told their friends with the same conditions, and I steadily had an increasing number of patients that I put on low-dose naltrexone, who then told their friends, and I then I currently have a large practice with patients on low-dose naltrexone for various ailments.
And what would you say the success rate has been?
Extremely high. The majority of my patients take low-dose naltrexone either for multiple sclerosis or for inflammatory or irritable bowel disease. And I'd say the great majority of those patients have seen positive results from their low-dose naltrexone treatment, either in halting the progression of their disease or almost completely inducing remissions of their disease.
And how long would you say it takes for LDN to work?
I've had patients tell me that they've had results in a matter of a month and some up to 5 or even 6 months later. The time that low-dose naltrexone seems to work is very variable. Mm-hmm. So I've had very variable responses from a month to 5 to 6 months after starting treatment.
What side effects would you say your patients have experienced?
Mostly vivid dreams, which seems to go away after a couple of weeks. In some patients, they do have gastrointestinal complaints. Some patients have told me, especially the multiple sclerosis patients, have told me that if their dose is too high, they have some mild spasticity, and we just adjust the dose accordingly. And some patients have non-specific complaints. They just say they don't feel right on it. So we tend to adjust the dose or change the way the low-dose naltrexone is given. Sometimes we have to put them on a transdermal low-dose naltrexone to reduce their side effects.
And how long would you recommend somebody to continue taking LDN even if they didn't think it was working?
Well, I would recommend a minimum of 6 months before saying that it's not working for them. Now, if it still doesn't work, we have to look for other issues. Sometimes I find my patients are not absorbing the low-dose naltrexone. Mm-hmm. And then sometimes I find that maybe we can change the way we're giving the low-dose naltrexone. Many of my patients do have concurrent yeast overgrowth, so sometimes we have to treat the yeast overgrowth to improve their response.
So if you look at other conditions that maybe are stopping the LDN from working, how many people would you say actually LDN doesn't work for? Well,
again, for the majority of my patients, they do work, and the results can be quite dramatic. In some patients, for example, in the patients who have multiple sclerosis, we know that the disease is not progressing. So sometimes we have to decide, is it the low-dose naltrexone or is it just that the natural course of the disease? I like to think the low-dose naltrexone is halting the progression. But for the most part, most of my patients do either see no progression of their disease or a dramatic improvement in their disease.
And what about other prescribing doctors? Would you say the number of prescribing doctors is increasing?
Oh, absolutely. I think it's definitely increasing as there's more and more awareness of low-dose naltrexone, but it's still only a small number of doctors who prescribe it.
Do you think that some doctors are a bit wary of prescribing a drug off-label?
Oh, absolutely. There's definite resistance to prescribing something off-label or a medication that you have no experience in using. Don't forget, most drugs that we use we're comfortable with because we use the drugs during our medical training. Things like anything from anti-inflammatories, blood pressure medications, cholesterol medications, antibiotics. Pain medications, we've used this in a setting, in a hospital or clinic setting in our training, so we're very comfortable in using it. We know the response, we know the side effects. Low-dose naltrexone, however, most physicians have no experience with, so there's always a little bit of a hesitancy or reluctancy to use a medication that you have no experience with. I think it's important to improve the awareness of low-dose naltrexone because this particular treatment can definitely benefit many people and at a very reduced cost.
Well, thank you very much for sharing your experience with us.
My pleasure.